Medications, that's my realm. This one is really, really interesting because we have been using glucosamine chondroitin in dogs for a long time, and I don't know why we aren't using it in cats. Cosequin makes a Cosequin for cats. You can probably around here someplace, you can get it at most of your pet stores. They're little flavored capsules that you just open. Glucosamine and chondroitin are the building blocks of cartilage. That's what you feed to make cartilage. And arthritis is the rubbing of two cartilage surfaces together. And as you do that, it gets thinner and thinner and thinner. But if you're feeding it, then it replaces itself. And if you're not, eventually it gets down to where you're stimulating the nerves, the nerve centers underneath them. Your protective level is thinner. Now the nerves underneath it are tingling, and now the whole process of inflammation and osteoclasts moving in, osteoblasts moving in, making arthritis diffuse that joint so it doesn't move because it hurts. So, I mean, even in a young cat, 4, 5, 6 years old, because they do so much wear and tear on those joints, get them on a Cosequin. It will really give you a help. NSAIDs. Cats cannot take Tylenol, Advil, Motrin. Those are not metabolized properly in the liver, and so they are toxins to the liver. Aspirin can be given, but it needs 3 days to get out of the system. So if you give an aspirin, you only give it once, and you don't repeat it for 3 days. But the reason why aspirin is not used in people anymore, and not used in dogs, and not recommended for cats with pain on a long-term basis, is because it takes the inflammation out of the joint, but it speeds the destruction of that cartilage. And so you turn, the studies were, you turn to an arthritic patient who could manage before they needed a knee replacement out for 10 or 12 years, and you give them aspirin and they need it in about 2 or 3 because you've eaten that cartilage away. They felt good for 2 or 3 years, but then they were due a replacement. That's been studied in both in dogs and has been looked at briefly in cats. So the NSAIDs you're talking about here are a little bit limited. The only one that is approved orally for cats is a drug called L.A.S.E.R. It's a chewable pill. And I have had some success using it inside, like crushing it up and putting it in food, but you know how cats are about that. You do that, and that's not the food I'm going to eat. If I'm going to use it in a chronic basis, I have people start with just putting a pinch, and then, for a week, and then 2 pinches for a week, and get them used to that flavor. Knowing that in about a month I'll have them, so I can get them treated for their pain. But they're going to accept it, and they're going to eat. So that's how I introduce L.A.S.E.R. if I need to use it for something that's a chronically painful condition. Medicam is only approved in an injectable form for cats. We use it, in post-surgical kind of inflammation. It is approved in Europe for oral use in cats, and so once I explain that to you, I have used, Medicam to treat chronic pain in cats, or I've used it for a short-term basis on something that's relatively painful. Rimadyl is not approved for use in cats, but it has good studies to use it injectably, carprofen, and we also know that it has been approved in Europe to be used in cats for pain. So again, that would be something that we would use, but somewhat limited because we don't have the backing. We're allowed to use that by license, I can do that, but it's not approved for use in cats. So there's some limits to those NSAIDs. We don't have very many. Steroids, cats are uniquely interesting about steroids because they don't tend to have all of the negative effects of steroid use in people and dogs and horses and so forth. but they get diabetic with steroids. So it doesn't, cause the buffalo hump. It doesn't tend to cause them to get fat. It doesn't tend to make their, give them ulcers in their belly. It doesn't tend to do some of the things that wear out the musculature of your cat out. But it can create diabetes. It's one of those drugs that I need to use steroids. It's because your cat's so sore that I need to use steroids. And probably, I hope that he doesn't get diabetic, but he's probably not going to make it to where he gets diabetic. So that's kind of one of my last resort kind of drugs that I'm using. If I use it, I try to use it every other day if I can, because that gives us a little bit more protection against that side effect even. This one is an interesting category, and we're seeing a lot of use with the opiates. We use a lot of opiates for surgical pain. Sent Kit Kat home with some opiates with the bladder pain. There are some interesting forms with the patch that you can use for the 4-day release of pain medication. Long term, you can use that. And we have used those in some chronic pain situations. There are some interesting new looks at using long-term opiates for chronic pain. So that's probably the first place I go with pain before I go with steroids or NSAIDs. Gabapentin has been used, is kind of in the research stage, but we've seen some good stuff with gabapentin for pain. And amitriptyline has had some interesting studies done for the control of pain. But all in all, that's a relatively short list of drugs that we can use. There's a whole lot more in people. There's a whole lot more. Categories are kind of the same, but we have a broader ability to use them. Cats are different creatures. Their livers do different things. Their kidneys do different things with metabolizing drugs and so forth. So we have to do this very uniquely for cats. Physical therapy. This one is becoming more and more interesting to us because it's so natural, and it doesn't involve having to give them anything that potentially does harm. Every drug that you take potentially has a negative side effect too, but we weigh that the positives are better than the negatives, and we use them. Massage therapy, you've probably already been doing that with your cats, giving them a nice rub of the hip muscles and the back muscles. Love the back muscles, go after it, because if that's the way they move, that's where they need just good massage therapy. Warmth, those kind of things are really, really helpful for our cat. They love it. Acupuncture is being used. I haven't used that very much because I'm really loving my laser. And this is really the place where I think there's a wide open modality that's going to really help us with pain of all sorts. L.A.S.E.R is an acronym for light amplification by stimulated emissions of radiation. Oh my gosh, you have to go back to your physics class, which I had to do to learn what that was all about. But it's basically that we've excited light so much that it can penetrate. And light has some very interesting properties that it can do. And so we have started enjoying the use of laser therapy to help our cats feel better for all kinds of situations that might be painful. These are really laser light blocking goggles, and it's really funny how many cats love those. I thought when they first said we're going to have to put goggles on them, and the operator, you can't quite see them, but they have them on too. But I thought, oh, that'll never happen with a cat. They love these things. It's amazing. And then this is the delivery system that you see here, and it's attached to the actual the machine that excites the light, and then it goes through a fiber optic cable down to the delivery system that penetrates that light. The, the advantages of laser, as you can see here, is like amazing. Anti-inflammatory. So any process that involves inflammation can be almost stopped in its tracks with laser light, as long as you can penetrate to it. So, for instance, I can't penetrate to a pancreas that's in the middle of the belly, but I can penetrate to a kidney because they're right up against the back. I can penetrate to the tissues around the pancreas that are irritating, secondarily to the pancreas, but I'm not reaching the pancreas itself. So anything that has inflammation, I can penetrate. We have a staff member who, is given around on her knee on Saturday, and she comes back after laser therapy, and she's walking like this. Now, it will have to be repeated for a while, and that's one of the downsides. Yeah.
What does it cost for laser therapy?
The cost depends on who's delivering it. At the moment, our cost, we do $24 for a single treatment. Or most of these guys, if you're doing chronic treatments, you're talking about, a month we do $240. I think it's $240 for you to come every day for therapy. And then the second month, if you do the first month, the second month, it reduces something more than that. I'm not sure what that is. So it's not horrible, but it is an expense, and you have to figure that as you're doing that. It is covered by VPI insurance, so if you carry VPI insurance for your PAT, it's covered. So you only pay 80% of that. It has been really, really useful in all those inflammatory processes. So if a cat that had his foot up, I would give him antibiotics because it's infected, but I would do a laser to start bringing the inflammation down. It has an analgesic effect, so it takes the pain away, and it really does. It's amazing what they'll do. It has, it actually speeds the healing, and that's the thing. I mean, I love that they don't hurt. That's important to me. But this is bigger. This means that a wound that's going to take 10 days may only take 7 days to heal. I've got what they call a degloving injury right now, where the cat, a car pushes the cat along, so it just like files the skin off of the leg. And that we saw that on Monday, and the lesion was about the front part of that leg, the whole front part of that leg, and it's about this wide now in 5 days. So I'm on Friday. It's amazing. So that's important. That's cool stuff, because what do cats do when it's open? So if I get that thing healed, if it doesn't hurt, so we're not licking it, if it's going to heal, if I can get it to get the tissues stimulated to heal, come on, let's do it, yay, to heal quicker. The vascular is kind of part of the reason why it does, it improves the blood supply to that area. That brings all that healing stuff to your area. And it increases how active those cells that get there are. Here's why I tend to do the laser instead of acupuncture, because it triggers the acupuncture points. So I don't have to be sticking needles in. I can trigger the acupuncture points with the laser. It reduces the fibrous tissue formation. So this cat who heals is going to have a very small scar, and he's going to be able to bring hair back onto that area. Not a big, nasty scar that never has hair again. Cosmetic, but inside it's not. If you got a lot of fibrous tissue that binds, the intestines to the uterine stump to the, then things don't move normal inside. So it reduces that scarring tissue formation. Improves nerve function, so that it normalizes that pain release. So you're not seeing as much pain relief. Immunoregulation, that's bringing the immune processes to bear so that your open wound doesn't get infected while it's healing. And of course that all adds up to faster wound healing.